guys, it's Faye from Solar Flow, and I am back with an all new video. Today's topic is a behind the veil channeled information read on mammograms. We are going to be exploring not only the 3D information into what it is and why it is so widely used to detect breast cancer. We are also going to be exploring the behind the veil explanation for why it is so widely used, as well as if it is in fact true that it is the best course of action to detect breast cancer. Now, before we dive in, before we go anywhere, I first have to say this, the information in this video should not be used to override or supersede your own sense of body autonomy. I am not doing this to convince anybody of anything. I got no agenda other than to share the information. This was a topic I was asked to look into. I thought the information that came in was interesting. I thought it would be interesting enough for it to merit its own video, hence it's getting one. I don't have any agenda. As I always say, you do you, boo. But outside of me not having an agenda and just wanting to be the messenger and share the information, I do also have to just tell you, hi, hello, my name is Faye, and I am not a doctor. I do not play a doctor on TV. I do not even have Bill Gates money, and that makes me somehow think that I am entitled to be an infection disease specialist. No. So please do not use this video to give away your own sense of body autonomy, nor should you be using this video to replace medical advice that you would receive from your doctor or some sort of a conclusion that you would come to after consulting with your doctor on if a mammogram is right for you. I'm just the messenger, y'all. I'm just the messenger. Please do not use this video to give away your body autonomy, and it should not be used to instead of or to replace medical advice. Okay. Now, we're actually going to be getting into some 3D information onto what mammograms are. No, it's not because I don't think anybody knows what they in fact are. It is, however, because after I had channeled the information and then I had sat down to look into it, I found the 3D information to be rather interesting, the way that it had interacted with the channeled information. Thus, I'm going to be sharing it with you because, again, y'all, I'm just the messenger. I report, you decide. Okay, so some 3D information into what mammograms are. This is all acquired off of YouTube. I spend so much time on YouTube. No, this is all actually, in fact, acquired off of Google, okay? So mammograms, for anyone who does not know, are x-rays of a breast or breasts that can help detect breast cancer, according to Google, early, or before it can be felt or can cause noticeable symptoms. And according to Google, mammograms are the best way to find breast cancer for most women. Now, the way a mammogram is done is because this is a soft tissue, and it's not like if somebody was getting an x-ray of a broken arm. The way that it has to be done, because again, it's soft tissue, is the breast is laid down on a plate, not like a dinner plate. It's laid down on an x-ray plate. So you have the plate under the breast, and then there's another piece that goes on top of it, and it squishes the breast so it can actually x-ray it. I'm sorry, I don't even know why I felt the need to like demonstrate that. That was just weird. But please excuse me for that weirdness. Unless you like weird demonstrations, you do you, boo. So it is put in between two plates that can actually x-ray the soft tissue. Now, this I did not know prior looking into it. There are actually two different types of mammograms. One of them is a screening mammogram. Now, this is done to check for cancer in women that have no signs nor symptoms of it. So this is the one that is recommended to women, all women, after the age of 40 years old. But there is also a different kind of mammogram that is a diagnostic one. This is one that is used to check after a lump or other signs and symptoms are found. What I also had discovered when looking into it is there is a small amount of ionizing radiation that is used when doing the X-ray. Now, this is not uncommon. This is not specifically or unique only to a breast X-ray. X-rays of all kinds do have some level of radiation that is involved in it. If you've ever gone to the dentist and you've ever had your teeth X-rayed, you know that they put you in like that little smock thing to try to not expose the rest of your body to radiation. Like why they don't actually like put a hat on your head also so to protect your brain from the radiation is beyond me, but don't ask questions. So the ionizing radiation has been found to increase a risk of a woman developing cancer later on in life. No agenda, I'm just reporting, you decide. You do you, boo. I had also discovered that most insurance companies will cover the cost of a mammogram. However, for any woman that does not have insurance, it can cost anywhere between $100 and $300. Although I think I had also read that there's been some sort of a bill passed that any woman, grammar matters, over the age of 40, can in fact get a free mammogram, whether or not she has any level of health insurance. Now, what I also had discovered when looking into it is that in the US alone, I can't speak for your country. I got viewers from all around the world, God bless. But in the US alone, between 10 and 12% of all mammograms result in a false positive. Now, what is a false positive? It is where the result comes back as being positive, that cancer was detected, but in fact, no cancer was detected. This is between 10 to 12% of all mammograms that are done on an annual basis. However, the more amount of times a woman will go and have a mammogram done, the more amount of false positive it actually creates. Here's why. This is wild. After 10 years of somebody having them on an annual basis, that means somebody goes and they get, like a good little girl, they go and they get their mammogram every single year for 10 years. They then have between a 50 and 60% of having at least one false positive. Could be more than one. So this means the more times you go and get a mammogram, the higher the rate of false positives there actually are. So much so that after a decade of getting them done, the rate rises, from 10 to 12% getting a false positive to between 50 and 60% getting a false positive. This is going to be notable on the energy reading as well. Everything I'm sharing with you of a three-dimensional nature has a reason. Now, I'm also going to share with you that although Google and doctors will tell you that mammograms are the best to detect early breast cancer, there are a number of doctors and researchers that are in fact skeptical of the benefits of mammograms, and they also question the dominant narrative that they save lives. And why, you may be wondering. Here's why. They point to the numbers of false positives that mammograms produce, as well as the overdiagnosing of cancers that are not harmful, nor would they be fatal, nor would they be the kind that would actually necessitate any sort of medical intervention. In addition to that, they will cite the overtreatment, including radiation exposure, as reasons why that they do not recommend it. In addition to that, there is a Canadian study that had found no difference in the unalived rates between women who had had mammograms and women who had only done a breast exam themselves with their own hands. Again, I'm not a doctor. Please do not use me sharing this to supersede your own sense of body autonomy or medical advice. This is just what I discovered when doing the 3D research. If you yourself want to look into the Canadian study, please go ahead and do so, but do not ever, not just about mammograms, please do not ever give away your sense of autonomy to any reader on YouTube. That is going to conclude the 3D information prior to the video. Now, I'm also going to share with you later on in this video, there is some additional supplemental 3D information that I had discovered, but when I get to it, I will tell you that that is what it is. If it's channeled, I tell you. If it's opinion, I tell you. And if it's 3D, I tell you. So there is going to be some more 3D information later on. However, this now here is going to begin the channeled information that I had received when looking into mammograms. So what are mammograms really behind the veil? Because we're not talking about the 3D. We're not talking about this is the best course of preventive whatever the fuck. What is the real reason behind the veil for mammograms? This is part of the war on women. This is part of the war on gender. This is just another arm in we are not breastfeeders, we are chest feeders. We are not mothers, we are caregivers. So how is it part of the war on women and the war on gender? By making women once again feel like one of the elements that biologically make us women. Do you have a vagina? Do you have ovaries? Do you have breasts? Biologically, you're a woman. Not talking about how you identify. If you identify as a llama, okay. Biologically, it's one of the markers of what makes a woman a woman. So it is attacking us because it is telling us that one of the elements that biologically make us a woman and allow us to feed our babies can, in fact, unalive us. Further than that, it is also a way to take away from the divinity in our design and to show us, look, ladies, what God gave you can also, in fact, unalive you. So it's a way for the cabal to stick it to God. And it's as if to say to God, look, God, at your faulty design. Because what do we in fact know about the cabal? They are obsessed with sticking it to God. They are obsessed with artificial intelligence because then that takes away from the divine intelligence that went into creating all of us. They are obsessed with confusing us about what our genders actually are by telling us the body that you're born into is not in fact the right body. So it's a way of saying God didn't get it right. God put you into the wrong body because you actually were meant to be born as a man, or you were meant to be born as a woman. God didn't get it right, but through the advent of modern medicine, we can get it right. God created a faulty design because it can kill you. Now, you may be wondering, okay, Faye, but that's kind of a weak argument that you're making here. I get it. People don't even know what women are any longer. And not just because there's a documentary called What is a Woman, but because one of the Supreme Court justices, when asked what a woman is, said, I don't know what a woman is. And because there's articles actually being released on the internet right now that proclaim there are no biological differences in sports pursuits between biological men and biological women. So you might be thinking, it's a weak argument, Faye. Okay, So riddle me this, Batman. Why then is there not nearly as much public awareness about testicular cancer? And if you don't know what that is, that's cancer of the testes. So it's a cancer that primarily affects men, biological men. Because does testicular cancer have an entire month devoted to creating awareness of it? Is it Testicular Cancer Month? No, but we have Breast Awareness Cancer Month. Does it have a blue ribbon designed to show support of it the way breast cancer has a pink one? Do brands donate a percentage of their profit to researching testicular cancer? No. And there's a reason why, and no, it's not about the patriarchy. Not that I think anyone watching this would blame the patriarchy, but if you think about it, y'all, even those of us that would say the patriarchy is ruining all of our lives, so again, riddle me this, Batman. If the patriarchy is more concerned with men than women, why does testicular cancer not have Testicular Cancer Awareness Month? Why is Axe, not Axes, but like that body care brand Axe, why are they not devoting a portion of their profits to studying testicular cancer? But what is in fact the reason for it? Not the patriarchy. It is to continuously reinforce to us, women, that there is something wrong with our lady bits. And when we think about there being something wrong with our lady bits, through this over proliferation of Breast Cancer Awareness Month and all of these products that are being rebranded to be in pink makeup cases with the little plastic ribbon on it, just constantly reinforcing the idea, breast cancer awareness. We are being actually, in fact, programmed through all of the overproliferation of the awareness that there is something wrong with our lady bits. And when we think about there being something wrong with our lady bits, what does that in fact do? It will energetically disempower us because it's something that's out of our hands. We have no control over it. We have a faulty lady bit design. And what does that do? It disempowers us and creates a lot of what? Fear. And what is fear? It is one of the lowest energetic vibrations that exist on the earth plane. What else does fear do? Fear can trap our consciousness and our energy and our attention and our emotions in what? The 3D matrix. So this is just another way that they are reinforcing what is. But what is, in this case, it's breast cancer awareness. And it just creates a hell of a lot of fear. You have a whole month devoted to breast cancer awareness. There's so many companies that are, they donate, or so they say, 10% of all of their sales to breast cancer awareness research. Okay. But this got me thinking, is this appropriate levels of fear that are actually being created? Let's see. So this here is further supplemental information that I had looked up. This is not channeled. This was acquired off of Google. So we're going to be exploring if the amount of fear that is created, designed to trap our consciousness in the matrix, is it actually in fact merited? Or is it warranted? Is it an appropriate amount of fear that is actually being created? Let's see. According to Google, 2.5% of women diagnosed with breast cancer will be unalived by it. 13% of women that are diagnosed with breast cancer will be diagnosed at the peak age, which is 70 to 79 years old. The survival rate as a whole of breast cancer, according to Google, is 99%. So 99% of women that are diagnosed with breast cancer will make a successful recovery. And in 2024, the estimation of women that will be unalived by breast cancer is, this is only an estimation, 42,250 women in the United States. So the estimation for 2024, the year that I am recording this video, is that 42,250 women will be unalived by breast cancer. Now, in case you're wondering, is that a lot? Is that a little? I would like some additional context. I got you guys. This is also three-dimensional information that I had acquired. So for context, in case you need it, and you're like, I don't know, is 42,250 a lot or a little? Here's some further context. Over 100,000 people annually in the United States, because that's what we're talking about, will die of an overdose in 2024. So that's roughly twice the amount of women that are going to be unalived by breast cancer. In 2024, the estimation is over 100,000 people will be unalived by drug overdoses. I have more context for you. Benzodiazepine, which is an antidepressant, unalives over 200,000 people annually. So what is that? 3 times the amount? So 3 times the amount of people that will be unalived by breast cancer are unalived by benzodiazepine, an antidepressant that a doctor will prescribe. I have more context for you. Sleeping pills will unalive between 300,000 and 500,000 people annually. More context. Analgesics. 70,000 people per year are unalived by analgesics. I have more. Over 100,000 people annually will be unalived from over-the-counter pain medication. So Tylenol, aspirin, over 100,000 people annually in the United States unalived. Tylenol, aspirin. More context. Over 100,000 postmenopausal women will be unalived by their antidepressant medication. This is separate from the antidepressant that I had mentioned just a moment ago. It's specific to menopausal women because not all people that take antidepressants are women, and not all of them are menopausal either. So over 200,000 people, so that's men and women that are not of a menopausal age, will die from antidepressants. I said the word shit. But over 100,000 specific to postmenopausal women are unalived by the antidepressant medication. So all told, between 800,000 and 1 million people in the United States alone are unalived annually because of synthetic medication. So between 800,000 and 1 million annually in the United States alone are unalived by synthetic medication. So then I ask, why is there no synthetic medication drug unaliving awareness month? Why are we not all given little white ribbons when we go to CVS to pick up our prescription to show our support for the #1 most preventable unalive cause in the United States of America? Why? Why is there no synthetic medication drug unalive awareness month? But there's breast cancer awareness month. And all told, between 800,000 and 1 million people annually alone in the United States will be unalived by these medication. Context. In the United States, the estimation for 2024 for women that are unalived by breast cancer is under 50,000. Why now? So why are we not all wearing white ribbons and proclaiming support for this just cause? It's because society has not programmed us to be concerned with it or about it. And also because if all of us knew, in fact, how dangerous synthetic medication could be, again, not telling you what to do with your own body and if you should be on it or not, but if we actually in fact knew how dangerous it could in some cases be, how many of us would want to be on our synthetic medications? It's not a cause because it makes Big Pharma too much money. So we have not been programmed to be concerned with it. Got it. That's why we're not told about it. But why we're told about breast cancer, awareness, month, research, to create fear, to capture our consciousness in the 3D, in the matrix, and to make women think that once again there's something wrong with our divine design. But is there in fact something wrong with our divine design? Last thoughts I'm going to leave you with. The most substantial rise in breast cancer rates in the United States was in the 1980s. Why is this notable? This is shortly after the FDA, as in the Federal Drug Administration, the same FDA that is keeping all of these other medications that are unaliving people at the rate of 800,000 to 1 million per year. But don't talk about that. That same FDA that's telling us all of those medications that are causing all those unalives, that same FDA recommended that all women over 40 receive a mammogram starting in 1976. And when was the biggest rise in breast cancer rates? It was in the 1980s, shortly after the FDA started recommending all women over 40 get a breast exam, i.e. a mammogram. So I ask you, what came first? It's the old chicken and the egg, right? What came first, the chicken or the egg? Did the chicken hatch from the egg or did the chicken lay the egg? What came first? Did the cancer rates rise because of mammograms being invented and then the FDA telling women that they should get their breast checks? Was it a rise because of the mammograms? Or was it because the mammograms were in fact catching them? Or were the mammograms causing them? I'm just your messenger. I report, you decide. But what came in very clearly for me at the beginning is this is part of the war on women. I report, you decide. So as always, guys, I hope that you have found this video to be insightful, maybe thought-provoking. I invite you to take what resonates and leave the rest behind, and again remind you, please Do not use this video to substitute medical advice that you yourself would receive with your doctor, in accordance with your doctor, and please do not use this to abdicate any sense of body autonomy over your own sense of self and your own body. I hope that you have found this video to be insightful, maybe thought-provoking. As always, please take the information that resonates and leave the rest behind. And as always, and until next time, stay in the high vibration and don't give in to that fear.